Hello, Lynn Watts here. And in this video, I'm going to be talking about specific strategies that we can use in helping children cope with trauma. The first one is to provide a safe and predictable environment. That is obviously easier said than done, but hopefully the school situation is one place where a child can feel safe and where it is predictable. So, in terms of as soon as possible helping a child to return to a routine that they can feel comfortable with, where they can anticipate what is about to happen. And also, and this is true for all of these strategies, advising the significant adults in a child's life to follow up on each of these strategies as well. So, if it's possible to provide a safe and predictable environment at home or in their community, that also, of course, is very valuable. It's hard to overcome traumatic situations if you're continuing to find yourself in a very stressful environment. The second thing, and again, this is a very good strategy to advise the other adults in a child's life on, is simply to be a good listener and to validate their feelings. So this is a matter of just saying to a child that you hear what they have to say, that you believe them, and that you help them express the feelings that they're having. And by that, I mean, you might simply say, it sounds like you feel, and then help them give some names to the feelings. And this is especially valuable to a child that is not terrifically literate in terms of feelings. So that may, of course, depend on the age or simply the type of environment that a child's grown up in terms of whether or not they're able to express their feelings verbally or not. But you want to validate that and simply let them know that any feelings they have are normal feelings to have after such an experience. The next step, of course, would be to help teach child some sort of relaxation technique. And this could be anything from just a simple breathing, something like maybe box breathing, teaching them different relaxation techniques such as tightening and then relaxing various body parts, some mindfulness types of strategies. And all of these, of course, help with things like flashbacks, intrusive thoughts, repetitive sort of things that a child might be going through in terms of the actual trauma. And especially because children may not be verbally able to express what happened or how they're feeling, helping them to develop some other types of expressive outlets are often very helpful. So this might include something as simple as drawing, expressing themselves through drawing or through acting out different situations, role play, anything like this where they could feel that they are able to get in touch with some of their feelings and work through some of the feelings they may have after the trauma. I think it's also important, as I've mentioned already, to um, provide information about trauma, the effects of trauma, how to help children cope with trauma to any other adults that are involved with the child. So that might be other teachers, that might be parents, that might be other people in the community that are helping a child to cope. And certainly, many times, depending on what the trauma was, these may well be other adults who could use some help in understanding trauma just for themselves as well as for the child. Um, I think that it's helpful also with children to provide, when possible, clear and age appropriate information about what happened. So, obviously, you want to keep that at a level that a child can understand. But just providing some simple answering questions is generally the best way to go about doing that. Not providing more information than the child wants or is ready to hear, but rather being available to answer questions in very simple ways. And then finally, we want to refer children for other professional support when that seems appropriate. And there are certainly many counselors and professionals that are specifically trained in trauma problems and trauma situations, helping children and other adults to cope with these very, very serious life changes. So I hope that is helpful in terms of how to approach the situation. And thanks so much for listening.